Keeping a resident's mouth, teeth, gums, and tongue healthy is a vital component of maintaining the resident's overall personal hygiene and good health. Poor mouth care can lead to tooth decay, gum disease, bad breath, and even a lack of appetite. All residents should receive oral care twice a day, once in the morning and again in the evening. This includes flossing the teeth and brushing the tongue, which should be performed at least once a day. Some persons require oral care every 2 hours. These include people who are unconscious, those unable to take fluids by mouth, those who breathe through their mouths, those who receive oxygen, are feverish or vomiting, and those who have a nasogastric or gastrostomy tube. If aspiration is a potential concern, be sure to have a suction tip connected to a suction source. Teeth are best cleaned with a toothbrush and toothpaste. If residents are able to brush their own teeth, encourage them to do so. Your role is to provide the necessary equipment and supplies. Some residents with natural teeth will need assistance. To assist with oral hygiene, you will need fresh water, mouthwash, a disposable cup and straw, a toothbrush, toothpaste, dental floss, an emesis basin, a cloth towel, and a pair of protective gloves. Identify the resident and tell her what you're going to do. Be sure to perform hand hygiene before giving care. Provide privacy and then put on gloves. Place the resident in an upright or semi-Fowler's position unless contraindicated. Spread the towel across the resident's chest to protect the gown and sheet. Place an emesis basin within easy reach. Prepare a mixture of mouthwash and water and instruct the resident to rinse her mouth with a mixture of mouthwash and water. Hold the emesis basin in place so she can spit out the water. Wet the toothbrush and apply the toothpaste. Encourage the resident to brush her own teeth if possible or provide assistance as needed. While you are assisting with oral care, inspect the resident's mouth, teeth, gums, and tongue for signs of bleeding, sores, loose or broken teeth, dry or coated tongue, and mouth odor. Report any of these signs or changes to the charge nurse. When she is finished brushing, have her rinse out her mouth with the fresh water. To floss the resident's teeth, first break off about 18 inches of dental floss and wrap it around a finger of each hand. Pinch the floss between your thumb and finger, leaving 1 to 2 inches of floss in between. Insert the floss between teeth and gently move the floss down to the gum line and gently move it from side to side between each tooth. Slide floss up and down against the tooth surface and under the gum line. Advance the floss to the next tooth gap and continue. Assist the resident to rinse the mouth with diluted mouthwash. Full-strength mouthwash may harm delicate gums. Dilute mouthwash according to your facility's policies and procedures. To finish, make sure the resident is comfortable. Return your supplies to where they were stored. Collect any disposable items. Properly dispose of the gloves. Be sure to perform hand hygiene after giving care. If anything unusual occurred, document it. Report your oral hygiene activity to the charge nurse or your supervisor. Denture care is an important part of daily health care of anyone with false teeth. It is recommended that the dentures be cleaned thoroughly twice daily. To clean dentures, you'll need tissues, mouthwash, an emesis basin, a denture cup, a toothbrush or denture brush, denture toothpaste or baking soda, a towel, and protective gloves. Be sure that the denture cup is labeled with the resident's name. Perform hand hygiene before providing care. Identify the resident, tell her what you are going to do, and provide privacy before beginning the procedure.
I'm going to be working around the area of your mouth to help remove your dentures and then clean them. So if at any time you need me to stop so you can rest, just raise your left hand. Okay?
After you place the patient in a semi-Fowler's position, spread the towel across the resident's chest to protect the gown and bed linens. Then put on gloves. Ask the resident to remove her dentures and place them in the denture cup. If the resident cannot remove her dentures, use a gauze pad to grasp the top denture with the thumb and forefinger. Pull downward to break the suction. Place the denture in a denture cup. To remove the bottom denture, place the thumb, grasp the denture with the thumb and forefinger, and pull upward. Again, place the denture securely in a denture cup. Then, take the dentures to the sink. Place the denture toothpaste and brush on a clean paper towel. To protect the dentures from breaking, line the sink with a washcloth or paper towels. Then put a small amount of denture toothpaste or baking soda on the brush. Hold one of the dentures securely over the sink and apply the cleaning agent. With the denture in the palm of your hand, carefully brush it until it is clean. After cleaning the denture, rinse it thoroughly under cool running water. Examine the denture for any rough, worn, or sharp edges. Repeat the procedure with the other denture. After cleaning the dentures, rinse the denture cup and fill it with cold water. Return to the resident's bedside. Using diluted mouthwash, help the resident to rinse her mouth. Hold the emesis basin to allow her to spit out the mouthwash. Check the mouth and tongue for the presence of bleeding or sores. Then help her replace the dentures. Be sure to leave the denture cup where the resident can reach it easily. To finish, make sure the resident is comfortable. Collect your supplies and any disposable items. Return any personal items to the bedside table. Properly dispose of the gloves. Be sure to perform hand hygiene after giving care. Document the care on the resident's record and report any unusual findings related to the dentures. Also report gum abnormalities, such as redness, bleeding, or complaints of pain or discomfort. Oral hygiene is an important part of daily care for every resident, even those who may be unconscious and unable to assist in their own care. To provide oral care for an unconscious resident, you will need an emesis basin, a towel, disposable cup and mouthwash, a tongue depressor, a mouth care kit containing commercially prepared swabs, and protective gloves. Identify the resident and tell him what you're going to do. Even though he is unconscious, he may be able to hear you.
Good morning, Mr. Collins. My name is Lynn. I'll be providing your oral care today.
Remember to perform hand hygiene before giving care. Provide privacy. Lower the side rail if necessary and put on gloves. Before you begin, position the resident as his condition allows to a semi-Fowler's or lateral position. Turn the resident's head to one side to prevent aspiration during the procedure. Put a waterproof pad and towel on the pillow underneath the resident's chin. His head should be turned to one side to allow excess fluid to drain out. Then place the emesis basin under his chin. Remove the swab from the package. Press on the cheeks and hold the tongue in place with the tongue depressor. Then use the swabs to gently and thoroughly wipe the entire mouth, including teeth, roof, tongue, and inside the cheeks and lips. Grasp the dental floss in both hands or use a floss holder and floss between all teeth. Lubricate the lips with the lip moisturizer or the lubricant provided. To finish, reposition the resident's head and remove the towel. Reposition the resident. Return reusable supplies to the bedside stand. Collect any disposable items. Remove your gloves and dispose of them in an appropriate waste container. Be sure to perform hand hygiene after giving care. Document the care provided. Be sure to document and report any bleeding, sores, cracks, or any change in the resident's condition to the charge nurse. Providing oral care is an important skill that not only maintains a resident's health, but also helps preserve a sense of dignity and self-worth.